Bilateral trans conjunctival. Conjunctival, bilateral trans. Hi YouTube, Fancy here from Fancy's Hair Innovation, and today is a very special day for me. I am getting a very special, long-awaited surgery. I am getting a lower lid blepharoplasty. And for those that don't know, a lower lid blepharoplasty is a procedure where the surgeon removes excess fat from your lower lids. It removes that baggy look. Sometimes you may have a little bit of discoloration, that sleepy look. So I'm going today, later on today, to get that procedure done. And I'm really excited about it. I've been waiting for a long time to get it done. So the day has finally come. And the technique that I'm gonna go with is called a bilateral trans conjunctival procedure. And basically what they do, I have some notes so I don't miss anything. Basically what they do with this type of blepharoplasty is that they remove, what the fuck?
Earlier, I was like, they picked the most peaceful time to mow lawn, and then when I went out there, I was like, oh shit.
Now you chopping down trees? Like, I'm trying to record.
They chopping down trees, girl.
Okay, so look, they're just gonna. Hi, y'all. No, I shouldn't do hi, y'all. Be in the room or something when I'm doing something. Like, it could be me doing hair, it could be anything, me interviewing somebody for work. Like, I be nervous. Like, I just can't. I just want to talk to y'all. That's it. I guess this is, you could call this a vlog. I don't know. It's my first time doing this, but I really just wanted to document. So I'm gonna take my glasses off as we do this video so you guys can get a better look of, you know, what I'm getting done before and after. And yeah, as you can see, as I like tilt my head down, they're more prominent. You can see them. Like, they're very, you know, they protrude. So I'm getting that done. This is something that I've been wanting for a very long time. Sorry, I had to put my glasses down. The technique that I'm going with for my surgery is called a bilateral trans conjunctival blepharoplasty. So what they do is they are removing the excess fat by making an incision on the inside of your eyelid versus on the outer side of your eyelid. So I'm very happy with that decision. I felt like that was the best decision for my anatomy of my eyes, and also being an African American, like, we get hyperpigmentation and scarring and things like that. And even though I do very well with scarring and my scars tend to clear up pretty fast, I didn't want to take the chance. So me and the doctor, we spoke about it, and we both decided that this is going to be the best route for me to go. So I have a few notes here because I don't want to miss anything, and I want to make sure that before we go to the surgical facility, I share all my bullets that I want to hit. So what doctor am I going to? I'm going to Dr. Robert Zabowski. He is located in Paramus, New Jersey. I'm located in New Jersey. So I did some searching around. I looked at doctors in New York, a couple doctors in New Jersey, and also a few doctors in California. And after doing my research, I just felt like Dr. Zabowski was the best for me. I felt like, one, he has years and years and years of experience, especially with doing this type of procedure. But two, when I had my first consultation with him, it was via FaceTime, because we are during the pandemic and we're, you know, quarantine and everything. So at the time, I think this was around March, April, we did a FaceTime consultation, and it just felt good. You know, his spirit felt good. I trusted him. I felt like You know, he made me feel very comfortable. He answered all of my questions. He was very patient. You know, he gave me his phone number, let me know if I have any more questions. I could reach out to him personally, texting. So I just felt, you know, it was very warm, friendly, and I felt secure and safe with him. So I'm like, you know what, I'm going to go through with this. And then once I went through the second consultation, which was in person, it was just, you know, I had to seal the deal. There was no doubt, so I had to go with him. The price range. So this procedure, a lower lid blepharoplasty, can cost anywhere between $6,000 to $10,000, depending on where you go and the area that you're in. I'm in New Jersey, so you can already imagine what that was looking like. But I ain't gonna put it out there because everybody is gonna get a different price based off of the type of procedure that you have to get. So I don't wanna give you a number and you go to a doctor and it's closer to 10,000 or close to 6,000. Like, you just gotta go through your own process, but just know it is in that range. So if you are thinking about it, that's something you should consider. Healing process, timeline. So when I first sat down with the doctor, he told me that because I have an office job, I can technically go back to work on Monday. It's Thursday now, so I would have my time to recover throughout the weekend, and I can go back to work on Monday. However, I decided to take a week off because, yeah, I may be able to, you know, sit in front of a computer. However, but I just didn't want to take the chance. And as he said, the actual stitching and, like, you know, you being able to get up and do things, sit on a computer, do your job, you can do those things, but you're not fully healed. And as far as timeline goes, I would say it's going to be around maybe 4 to 6 weeks where I start to see a complete change. Because when I get out of the room, and I'm gonna come back on and show you guys what I look like, what I feel like once the surgery is over. But from most videos that I've seen, everyone has, you know, a lot of swelling and bruising and just, you know, discoloration. So I know that that's going to last for some weeks. I also work out, and he let me know that I'm not going to be able to do any like exercise until at least 2 weeks. So if you work out, I guess just keep that in mind. So let me see, last but not least, why did I want to get the surgery? I wanted to get this surgery, one, because lower puffiness and bags is something that's hereditary on my dad's side of the family. Like, a lot of it came from my grandmother. Like, I don't know, it just got passed down generation, especially with the women, we get them. So I've had them since I was 5 years old, you know, since I was a baby, actually, I've had them. So, and as I get older, they just get more heavier and heavier. Honestly, y'all, today they don't look as swollen as they can be. And I don't know why. I think, you know, my allergies aren't affecting me today. I had a good night's rest. But some days they can be really bad. They can be really bad. And so it is a genetic trait. And one, I just don't want to look sleepy anymore. I don't. I want to look bright. I want to look refreshed. I'm young. I'm in my late 20s. So I feel as though, you know, I should still have that energy, you know. And the thing is, perception is reality. So if I look at myself and I'm looking sleepy, I'm not gonna lie, I feel sleepy. I'm like, I need to take a nap. I look so tired. I'm, you know, I'm just exhausted. And I could have had 8 hours of sleep last night. But so I'm very, very happy about this. I'm excited. A little bit more on the procedure. You will need somebody that's going to take you there and bring you back home, because you won't be able to drive. You won't be able to see that well. So please make sure you have somebody that can take you there and from. And then you also need someone who can stay with you overnight to monitor you, making sure that you're not getting any blood clots throughout the night, specifically in your legs. When I had my call with the nurse, my pre-op call, she was saying that after the procedure, when you go home, do not lay down right away. You need to stay up, you need to walk around, keep the blood flowing, things like that. Your eyes may leak a little bit of blood, and just it's gonna be fine. I have my eye drops, I have my antibiotics, pain meds. So yeah. I also wanted to get on here and vlog this whole experience for you all, because I know when I was looking and searching and getting more information on this surgery, I couldn't find a lot of people, especially of color, that got this done. So I wanted to go on here and just share all of my experiences and what I go through. So if there's anybody else out there that wants to get their lower bags removed, they can find a video with some information. So that's all I have for you guys right now. My appointment is at about 3:30. Yeah, I have to be there by 3:30. So when I'm in the car and I'm on my way there, and when I get to the office, I'll hop back on. But that's it for now, guys. Thank you so much for tuning in, and I'll be back. We're in the car. We're on our way to the doctor's office. My cousin is driving. Hey. We have Kendra in the back. She's going to be my caretaker for the night. Oh, man, I'm so excited. I forgot to tell y'all. So, in my earlier video, I was looking real ashy and dry because I can't put anything on my face. I just had to use, like, antibacterial soap to wash my face. No lotion, no creams, no nothing. So my lips is dry. I have like dried up scabs and like pimple marks because I had acne breakouts like a week or so ago. So I'm still trying to like clear up my skin. So it is what it is though. We're on our way. I'm excited. I got my comfortable clothes on. Hello. They recommended that I wear something that I could just like unbutton or unzip. When you go home, you don't got to pull nothing over your head. Got my big glasses on because I imagine I'm going to be swollen.
Use the right lane to take the exit towards Saddle.
We're on our way. I'll tune back in once we get into the office. All right, guys. So we're at the doctor. I am utterly excited for this. This is the last moment where I say goodbye. Yes, look, now you can see better. I say goodbye to these things. Au revoir, so long. So, I'm waiting for the nurse to call me back. I'm a little anxious, but I'm not afraid. I'm more so excited than anything. I've been waiting for years and years and years for this, so. I'm excited. I can't wait. So when I go back in the room, I'm gonna come out a new woman. All right, guys. So the doctor just left and he did the markings under my eyes. And he's actually going to take a little in the upper lid as well. Just a little. Because I have some fat in the upper lid and it would just make me happier if it was gone. Sometimes when I wear my lashes, my eyes just look crazy. They get very like heavy, they look really closed, more so in my right eye than my left eye. But all in all, I think he's going to do what I hope and dream for. So It's almost time, guys. I gotta talk to the anesthesiologist, and then I'm going in. I'm going in.
Okay. So
I'm sorry, I have normal eyes, guys. Look at Lauren. She's been such a great help. Okay, we're gonna go over instructions. I'm gonna put this down. I'll be right back.
all right. So the Tobrax eye drops is the prescription
Okay.
eye drops. 2 drops in each.
All right, guys. So I'm home. And this is what I look like fresh out of surgery. I am very, very swollen. And I have some stitches in my upper lids here because he went in and took some excess fat out of the upper lid. But I'm really happy with the results, guys. Like this is just swelling. This will go down with time, as you can see.